We're going to go ahead and get started. The leader is on his way and feels very strongly about this topic and thought we ought to get going. Last weekend, I had 5 town hall meetings in parts of eastern Oregon. And these were communities where Donald Trump got almost 70% of the vote. And so in these deeply rural areas, there was a lot of talk about health care. And the Oregonians that I spoke with were really alarmed, and this was the case, even if they don't get health care through Medicaid or the Affordable Care Act. And that's because, as you hear what we're going to talk about this morning, you will realize that your health care isn't safe under Trump care. Donald Trump and Republicans have been actively misleading the American people. Americans were never told that their flawed bill will punch a hole that's a lot deeper than Medicaid. Americans who have private health coverage, like through an employer, a lot of them think they're safe. That's just not true. Insurance companies are increasing premiums by the highest amount in nearly a decade. In the coming weeks, Americans who buy private health insurance are going, even the insurance people are turning the lights on. Somebody touched one of those lights.
Yes, that's it.
There we go. The insurance companies are increasing premiums by the highest amount in almost a decade. In the coming weeks, Americans who buy health insurance on their own are going to be mailed notices about big premium spikes. Hospitals are discussing the possibility of closing their doors or winding down services like labor and delivery. For those that have already announced their closing, that means services aren't going to be available for anybody, not just folks on Medicaid. Long-term care safety under their bill is going to be jeopardized because of reductions in nursing home staff, regardless of whether your loved one is covered by Medicaid. States are talking about cutting optional benefits like home care for kids, which is critical in families like the little lobbyists, the wonderful little lobbyists. Let's have a round of applause for them. And I'm kind of a hawk on privacy, like my friend Senator Merkley, and I can tell you your health privacy is a lot less safe as health providers provide fewer dollars and invest in some of the essential services like cybersecurity. So that's why Democrats are here today with a simple message. Let's scrap Trump care. Let's scrap these cuts. And what we ought to be doing is working to lower insurance premiums like my friend Senator Shaheen is doing. Senator Shaheen is leading us, Senate Democrats, in terms of getting health care insurance for the working class and middle class folks. If Congress doesn't act soon on measures like Senator Shaheen's, Americans who buy health insurance are in for a world of hurt. They'll get those notices in the mail that the premiums are doubling. When they go looking for a new and cheaper plan, the only affordable options will be what we call Swiss cheese health insurance. That's what we called it back in Gray Panther days, and the holes in the Swiss cheese are getting even bigger. And if they even find that plan that works, they'll have to jump through all kinds of new verification hoops. They're going to have to go through a thicket of red tape and bureaucracy created by the Trump administration. And if you make an error, an innocent error in paperwork, they're going to make you start all over again, because that's what this is going to be like. A small business owner in Bend, Oregon, with a family of 4 is going to see their premium rise by more than $600 a month. And the longer it takes to stop the cuts, the more the American healthcare system will be shaped in the image Trump and Republicans have envisioned. Higher premiums, more red tape, bailouts for big pharma. That's what's going on with one of the really popular cancer drugs are raising the prices. So Democrats are saying, we're not going to sit around and watch people get hurt. That's why we're going ahead with the Shaheen bill. That's why we're going ahead with measures that deal with holding down costs. A whole group of us on the Finance Committee Senator Merkley has been doing good work on this. We're going to stop upcoding. You know, upcoding is a way that you jack up bills. Republicans aren't doing anything on that. We're taking the lead. So my colleagues here are going to walk you through where we're going. But I just want everybody to know that I think the Trump people have misled the American people and talked about Medicaid and lots of other people. We have 330 million Americans, and lots of them are going to get hurt by this deeply flawed bill. Senator Merkley. Oh, good, even better. Ladies first.
You know, we do everything in the Senate in order of seniority. So my friend,
bad manners.
Senator Merkley, is kind enough to recognize that I have more seniority than he does. So thank you, Senator Merkley. And thank you, Senator Wyden and Senator Lujan, for all of your excellent work and for the effort to ensure that all Americans have access to affordable health care when they need it. You know, I want to speak just to the enhanced premium tax credits that are going to expire at the end of this year, because what did not happen when our Republican majority passed the reconciliation bill is they did not extend those premium tax credits. And refusing to do that means that health care coverage is being actively taken away from families who really need the help. It means raising costs for millions of Americans at a time when they're already struggling with increased costs. And that pain, as Senator Wyden said, is being felt almost immediately, because insurance companies are looking at having to submit their rates, and they are increasing their rates. Premiums will increase for 20 million Americans. A typical family of 4 will see a $10,000 increase when those premium tax credits go away, and a typical 60-year-old couple would see a $17,000 increase. So think about that. Parents, grandparents are going to see $17,000 increase. And because of those increased costs, Americans are going to lose their health care coverage. The nonpartisan data shows us that 4 million Americans will lose their health care. More than 1 million of them suffer from chronic illnesses. So if they don't have health insurance, who's going to pay for that coverage to make sure they get their treatment? Well, everybody's going to pay for it. And that's on top of the unprecedented health care cuts to Medicaid that were passed as part of that bill. I heard from one of my constituents, Jen, from North Conway, New Hampshire. North Conway is a small community in the eastern part of New Hampshire. Her story, I think, shows just how important these tax credits are, because Jen was diagnosed with leukemia. She started getting chemotherapy to treat it, and she was able to, because of the Family Medical Leave Act, she was able to take time off from her job for 3 months. But then, because FMLA ended, she lost her job. And when she lost her job, she lost her health care coverage. Her husband had to act as her caregiver, but then he had to go back to work, and his employer didn't provide health insurance. But the way Jen was able to continue her chemotherapy was because she and her husband were able to afford health insurance under the Affordable Care Act because of those premium tax credits. They lowered Jen's premiums by $700 a month, and they allowed her to continue her chemo treatments. And look, when the reconciliation bill was debated and we saw the tax breaks for the wealthiest and the big corporations, a lot of our colleagues on the other side of the aisle didn't think $700 a month was very much money. But I can tell you, for Jen and her husband, $700 savings each month, $8,000 a year is the difference between being able to continue to have the health care they need, continue to put food on the table, continue to pay their rent, and losing all of that. But most important, the tax credits were there when she needed them, when she got sick, when she could no longer work. So the clock is ticking. We first introduced the legislation on this issue back in 2019. We've secured temporary extensions that have helped fuel record enrollment in the Affordable Care Act. But we're approaching another deadline. And we need to take action now to permanently extend those tax credits and to end the back and forth every year that people know, so people know they can count on them. So thank you all.
Well said, Jean. Jeff Merkley.
Back when I came to the Senate in 2009, we had a President Obama, and a Senate that said, hey, let's really work towards the vision of everyone in America having the opportunity to have affordable, quality health care. And in April of 2009, Frank Luntz put out a memo, and he was a strategist, and he says, whatever Democrats are doing, let's call it a government takeover. Whatever they do, we'll call it a government takeover, because we've done focus groups, and that scares people. Well, I quickly saw how scared people were as I started doing the town halls following Senator Wyden's example of a town hall in every county in Oregon every year. And people were terrified. They were showing up in extraordinary numbers and so angry. Why would you take over our health care? And I'd say, you know, and they'd say, why don't you listen to us? I'd say, okay, I'll listen to everybody in the room. And I'd say, I'll recite some of the provisions of Obamacare, and you can tell me step forward, step backwards. Cover pre-existing condition, 80% of the room, rural Oregon, angry people. Oh no, that piece we like. And your children being on your policy to age 26. Oh, 80% of the room. Oh yeah, we like that. And I went through different provisions, but two of the provisions that were engaged here was one, tax credits to help middle-class families buy health care. Oh yeah, universally, we really like that. And expanding Medicaid in order to cover the gap between our less affluent families that currently have Medicaid and middle-class families who will be able to buy health care in exchange. No, that's great. And a side benefit, a lot more revenue flowing into our rural clinics and our rural hospitals. So 2009, a blue trifecta says, let's fill in the gaps and make sure that everyone in America has opportunity to have health insurance so that when they need medical care, they'll be able to get it. Now let's turn the clock from 2009 to 2025. And we have a red trifecta. And what is their message? Let's tear down health care so millions of American families will suffer. 2009 blue message, let's fill in the gaps so everyone has health care when they need it. 2025 Republican message, let's tear it down and let families suffer. That's the extraordinary distinction. And that's why we are here at this moment to say we need to reverse what my colleague just called Trump care, what was done in the big, ugly betrayal of a bill where it tore down the ability to provide those premium tax credits under Obamacare, when it proceeded to put in danger Medicaid across the country by changing how states could provide matching funds to keep Medicaid going. What does this mean when a family loses health care? It means, well, they often have to choose between paying their rent or buying their groceries or paying their health insurance, going broke. They have a medical condition and they don't have health insurance, now they're in big, big trouble. You know, we're the only developed country in the world in which people routinely declare bankruptcy because of medical conditions, even with what we have succeeded in doing since 2009. But this big, ugly betrayal of a bill took us the opposite direction. What else happens? Rural health care suffers. We saw last year in Baker City, Oregon, a maternity care ward shut down. People are going to have to drive 70 miles, and in winter that highway is often shut down in order to deliver a baby. How scary is that? Pretty damn scary. And that was with expanded Medicaid. What happens if that's not there? What happens when you lose Medicaid coverage for 15 million Americans? Well, I can tell you what the experts are saying. They're saying 300 rural hospitals and clinics will be at risk of either shutting down or greatly curtailing their resources. That's the authority, the Shep's report, a real authority on rural health care. So this is wrong. It does so much damage to the quality of life of so many people. I hate the fact that we will hear stories about people who didn't go when they had a condition And 6 months later, that small lump turned into ravaging breast cancer, or so many other possibilities when you don't get care early and effectively. So that's why we're here to say, hell no. Hell no to the big, ugly betrayal of Americans. Let's restore the cuts that were torn down, that were established, the savaging American health care in that bill, and let's apply those enhanced premiums to keep health care affordable for middle-class Americans. The numbers for Oregon, for people buying health care on the exchange, it will be a 68% increase in their premium, about $1,300 a year on average. That's a deal breaker for many families. Let's not let that deal breaker happen. Thank you.
Look, y'all, little more than 3 years ago, I survived a stroke. And there's a lot you learn when you get a little dizzy, you can't stand up, you don't know what the hell's going on. Unfortunately, my sister happened to be next door at my mom's house and got me to a hospital quickly. Because it turns out when you have a stroke, time's not on your side. If they don't treat you right away, you might not get better like I got better, like I was blessed to heal. And what Republicans did in ripping away health care with this vote a couple weeks ago is they're jeopardizing more and more loved ones across America, not just those that might suffer a stroke, but other challenges that they may have where time's not on your side, where instead of going to a rural health clinic that might be 30 miles away, you might think 30 miles. Well, I come from rural America. 30 miles is close. And now these facilities are going to be hours and hours away. If I had to drive hours away to get to a hospital, I'd be dead today. I would not be here. I probably would not have survived. So why are my Republicans colleagues saying to the American people, oh no, don't you worry, you can trust us, we're not going to rip your Medicaid away? And then in the dark of night, boom, they cast a vote and they lied to their constituents, they lied to my constituents, and now these rural health clinics across America are jeopardizing enclosure. And then what about everyone else who might not be able to afford care? What happens if they need help the most? And there's other families across America that do everything they can to take care of their loved ones when they can. Stay home. Stay with mom. There's healthcare providers here today that are home healthcare workers that fill in that gap, that provide more and more support to our loved ones, because loneliness is also something that can terrify you. But if you have a slip and a fall, something that Jean, as governor, she took advantage of her strength and knowing power to bring people together to say, we're going to find a better way to provide help to people in homes. Well, my Republican colleagues here just ripped that all away. It's not right. So I simply want to say thank you to my colleagues around us, to Leader Schumer, to Ron Wyden, and all others that see a path forward to restore these important programs, because it really is a difference between life and death. 60 years ago, some of our colleagues got together and said, you know, we can do something better in America. We can make sure that if someone gets sick, that they might be able to take advantage of some care, or be able to go see a doctor through the idea of this program called Medicare and Medicaid. And it grew and it grew, and it provided more certainty and support to our loved ones. And in one vote that was successful, my Republican colleagues just tore it away. I want to thank my Democratic colleagues for standing strong and showing the American people that we're going to stand by them, that we are on their side, and we're going to get these programs restored.
Well said.
Ben Ray is strong. Anyway, it's great to be here, and I want to thank Senator Wyden for helping lead this event, Senators Shaheen and Merkley and Lujan, who've said great words. And also, if you've been an advocate working hard to make sure that people know exactly what's happened, raise your hands. Thank you, thank you, thank you for what you have done. We need you. And we're going to have we need you all of August to pound away at this issue and let people know how bad it is. The more people know about it, the more they hate the big, ugly betrayal. And now more and more people are knowing about it because of the work done by my colleagues here, my whole Senate caucus, the House Democratic caucus, and all of you. So thank you very much. Look, I mean, it's hard to believe that people could be in this bubble, these right-wingers who are in the House and the Senate. I mean, to take away people's health care, do they know what that means? Do they know what it's like to have a daughter with cancer and Medicaid or ACA is paying for your treatment, and all of a sudden it's ripped away, and that $2,000 cap, which we all worked so hard to install, is gone in January? And what are you going to do? What are you going to do? My child is going to die. Why? Tax breaks for billionaires. Tax breaks for billionaires is why they did this thing. They have no rationale for it. They talk about waste, fraud, and abuse, and they can't find very much because there isn't. There's some. We want to get rid of it, but it's not close to even a tenth of what they said they needed to cut. The idea that people could find health care elsewhere? Bull, why do you think this was passed? Because for 2 centuries, America didn't have poor people, elderly people getting health care, and they were dying. And the fact that our life expectancy is so much longer and we live longer and healthier, one of the most important reasons, if not the most important reason, is we have Medicare and Medicaid. People are getting the health care they need. And what would the average American say they most want? I'll tell you what I would for my family and me: a long, healthy, good life. Taken away. So it's just unbelievable what these people are doing. The good news is that the American people are on our side. Every day, more and more of them come over to our side. This idea, folks, that there's no difference between Democrats and Republicans is utter bull. Just look at the vote. Every Democrat voted against the cuts. Every Republican voted for the cuts. I don't care if these Republicans said, well, it's not, I don't really like it, but I have to go along with Trump. Trump, who has no understanding of what average people go through and is in his own little bubble talking to his rich friends. Oh, yeah, I hear someone say, well, I talked to my driver. He's happy with things. Yeah, who's paying him? So we really need to, on this day, on this commemorative day, when, as was mentioned before, I think by Jeff, that Democrats and Republicans got together and said we have to pass Medicaid and Medicare, is a day that will be one of the great days in American history, and we can't let it go away. The fight is not over. We're just in the middle of it. We're going to fight, fight, fight until we win. And I want to thank our dear advocates as well, because they bring the personal knowledge to people of what this is. This isn't abstract. This isn't numbers. This is people in their lives, what they want the most: health for themselves, their children, their loved ones, their friends. We're going to fight until we win this fight. Join us. I know you are. Thank you.
We'll stick around and take a few questions, but the leader's juggling a little bit, and we're going to hear now from the little lobbyists, and then we'll take questions.
Thank you. Good morning, everybody. Thank you. Thank you, Senators. Thank you, Leader Schumer. And thank you to our partners, Caring Across Generations. Thank you to the friends watching on the live stream. Hello. I am Elena Hung. I am the Executive Director and co-founder of Little Lobbyists, which is a national family-led organization advocating for children with complex medical needs and disabilities. I am better known to some of you as Xiomara's mom. So thank you all for commemorating the 60th anniversary of Medicaid with us today. Medicaid is a life-saving program for millions across the country, including our Little Lobbyist children. And now I am honored to introduce a Little Lobbyist family. Chelsea Anders lives in Pennsylvania with her husband and 2 children. In 2023, Chelsea and her family made the very scary decision to leave their roots and community behind in Texas and relocate to Pennsylvania, where they knew no one. And the reason they did it, it was simple, to be able to access Medicaid and get the best for their daughter, Olivia. Chelsea?
So as you can, she's queen waving to everybody, just so y'all know. This is Olivia. She is quite the little firecracker. She just graduated from the 4th grade at Starkweather Elementary in Westchester, Pennsylvania, and she is whip smart. She's super opinionated. She loves to socialize. She's like having a ball right now. These trips to DC are maybe more fun for her than they are important to us, right? But we're here to make sure that everyone sees her and sees who is affected by Medicaid every day. So she loves to bake. She loves to sit on our deck and overlook a golf course and gossip and make fun of all the people that hit the balls into our yard. She also has cerebral palsy. As you can see, she uses this bright purple wheelchair for mobility. She also has a feeding tube that she uses for her nutrition, and she needs to be monitored for seizures that, like Senator Lujan shared, if she has a seizure and she can't get to a hospital in time, she also dies. So she uses a mix of communication tactics. She has an AAC device, and she also uses her own version of American Sign Language, which you might see, it's a very sassy version of American Sign Language is what we call it. You know, I'm not exaggerating when I say that Medicaid has saved her life on multiple occasions. She was born early. She went straight to the NICU. She spent 6 weeks there, and we wouldn't have been able to afford that without Medicaid. Our private insurance covers very little of her disability-related needs, so Medicaid picks up all of those things for us. It pays for her formula, her incontinence supplies, the medical equipment she needs. It pays for therapies at school. It pays for a nurse to attend with her so she can be an active and productive member of her community, both at home and at school. You know, it's also a relief knowing, and this is something that keeps us up at night, what happens to Olivia and how does Olivia afford her own care after we're gone? If Medicaid is not there to provide that safety net for her, what's going to happen? She goes to an institution, she's no longer allowed to be a part of her community, and all of this potential that we see for her is gone. It's gone. We wouldn't be able to do the things that we do with her, like bringing her here today, without the support of Medicaid. We're not asking for a handout. We are not participating in anything that we don't feel like Olivia should have the right to. We're just asking for a hand up, right? We're asking for everyone to support a program that equalizes our family's opportunities and Olivia's opportunities in the future. I will say that I did not participate in anything like this before having a child with disabilities. While it's great fun and it's really important, I love being able to show Olivia to the world in a way that proves her value, proves her worth, allows you to know her in a way that encourages you to go out and pass policies and bills and legislation that support her future. So we are not wanting to go back to the situation we had in Texas where no expanded Medicaid. She was on a 15-year wait list for a Medicaid waiver. We moved to Pennsylvania. We are experiencing wonderful opportunities. She's able to go to a gen ed classroom. She is able to participate in extracurricular activities, right? She has a future potentially at the collegiate level on the East Coast, right? Because we are in a state that will provide that opportunity for her. So we're here today to represent little lobbyists, but really we're here today just as the Anders family. We're just here today as Olivia and her mom, asking our government to make sure that they protect her future by canceling these cuts and protecting Medicaid.
Bravo for little lobbyists. And if there was ever a question of who was mom and who is daughter. Look at the DNA right here. We now, for our last speaker, the wonderful folks with Caring for Generations, right? Come on up.
Yeah, thank you, Senator. Hello, everyone. My name is Nicole Jorwick, and I am the Chief Program Officer at Caring Across Generations. We are working to build a movement for the care systems that families like the Anders families need. And we showed that just recently, along with our partners at Little Lobbyists and so many partners, during the 60-hour vigil that we held with our partners, honoring the 60 years of Medicaid and fighting back against these cuts. The energy to fight back continued over the weekend, where we had tens of thousands of people come together for Families First rallies to say, enough is enough. At Families First events in DC and in over 225 cities, towns, and hamlets across the country, thousands of families came out for one purpose: putting our families first. And that means canceling the cuts to Medicaid and the ACA. Those who attended, who spelled out familia on the beach in San Francisco, who rode in a Medicaid motorcade across the state of Indiana, and gathered in the National Mall, believe that no matter what, every family deserves to be cared for. Every child deserves health coverage. Every grandparent deserves to have the assistance that they need when they need it. And every disabled person deserves the opportunities to reach their full potential, including you, Olivia. And every caregiver deserves to see a doctor when they're sick. This is something that I know personally as a family caregiver. My brother Chris is 36 and has autism and receives Medicaid for his home and community-based services, something that Medicare does not. He calls it his lifeboat. The introduction of this bill gives me hope that we can save that lifeboat for Chris, for Olivia, and for the other 80 million people who rely on Medicaid. Thank you to Senator Schumer, Senator Wyden, Senator Shaheen, and Senator Merkley, and Senator Lujan for giving us a reason to be hopeful as you introduce a bill that shows that our voices matter. And I should note that this is a real repeal bill, unlike some of the others that we've seen. Yes. Now, and I encourage everyone to support the real repeal bill. And now it is my distinct pleasure to introduce a voice that matters a whole lot. Our Caring Across Generations Care Fellow, Cassandra Nelson from Georgia, who's going to talk about why Medicaid matters to her and her family and why they so desperately need to see this repeal become law.
Hello. My name is Cassandra Nelson, and I live in Camilla, Georgia, a rural county nestled in southwest Georgia, where access isn't guaranteed and care is not equitable. I'm a mother. I am a community health worker. I am an advocate. But before all of that, I am Amunette's mother. My daughter Amunette is living with diabetes, and she also experiences seizures. Our day revolves around managing blood sugars, watching for warning signs, coordinating appointments, and staying stocked on life-saving medication. Medicaid has been more than a benefit. It has been a bridge between life and fear. I would lay down at night and be afraid if something happened because I could not get her the care that I need if I did not have Medicaid. When people talk about Medicaid cuts, I hear silence behind the statistics. But in Southwest Georgia, we see the impact face to face. We see elders on dialysis skipping meals to pay light bills. We see children with chronic conditions waiting months for specialists. We see caregivers like me doing everything right, yet still feeling the system is stacked against us. Cuts to Medicaid aren't just budget decisions. They're decisions about whether people like Amunette get the insulin she needs, whether our neighbors get mental health support after a crisis, whether communities like mine get a chance to breathe, a chance to heal, a chance to live. I've walked many families through paperwork, the frustrations of denied coverage, and the fear of going without. And every time I advocate, I think about how many more stories go unheard. I'm here to say we exist and we matter. I've been told that I have the voice of a lion and the endurance of an eagle. And I will use that voice to repeal these cuts. And as all caregivers do, we will endure to create a system that my daughter and so many others deserve. When you protect Medicaid, you protect mothers like me, daughters like Amunette, grandparents who built this state, and members who still believe that their zip code shouldn't determine their worth.
This is one tough act to follow, and we've got just a couple of minutes because we've got some votes going on, and I just want to make one last point, and then we'll take some questions. And let's give Senator Shaheen a big round of applause. She's leading the fight. Fair enough. One last point, and we'll take some questions, and my colleague and I will both be available for a couple. The clock is running out. It says 11:45 out there, but for purposes of our business, open enrollment starts in November. That's just a few months. It's a couple of barbecues in the summer, and then it's November. And Americans are going to be in for sticker shock when they go to review their health insurance without the ideas that you heard my colleagues talking about. So this is not some abstract thing that my good friend from the Finance Committee, he's a little bit down there towards the end, but he always asks the best questions. We didn't make this up. These notices are going out in November, folks, not 2 years from now. So the stakes are really high. Feel free to give me a softball question. I guess that's one of the perks of seniority. Anything hard to my buddy, but we're going to have to go up and vote here in a minute. Are there any questions? Laura.
Thanks. I just want to ask about the ACA credits. It could be a real fight with Republicans. There are Republicans who don't want to extend the credits, or they're talking about it's too expensive or it goes to too high income levels. So what's the strategy to force them to the table, and should it be part of the government funding?
Laura, we have always said we'll work with anybody who wants to do the right thing for people. As you know, I wrote a book about it. You know, it's like chutzpah, grit and determination. Here is the state of play as of this morning. I am the ranking Democrat in the Finance Committee, where the two of us serve, and there has been no evidence to date, as of right now, that Senate Republican leadership is interested in a serious bipartisan health care discussion. I have not heard from any of the senior Republican leadership, but we want to help people. That's what the congressman and I are always in the business of trying to do. So when I emphasize that, but the state of play as of today, with a couple of days before apparently there's going to be a work period, there is no evidence from the senior Republican leadership that they want to do anything bipartisan. And I just told you, this is not going to be just Medicaid folks. People across this country of all ages are going to feel like they've been hit by a healthcare wrecking ball. So we want to get results. One last question, then we're going to have to zip. Okay, everybody. We're running out. If you got to grab the congressman and I, but we got to go vote. Thank you so much. Particularly, thanks to the little lobbyists. Thanks to the wonderful folks who are caring for generations. It sounds like my great Panther group when I was coming up. God bless you all. Thanks, everybody.